My name is Dr. Challenor. Most people know me as Dr. Ruth. I'm one of the GPs at the health centre on campus, and I'm also the clinical lead, so I help to run the practice. Well, it's vital that you're registered with somebody local in case you're unwell whilst you're at university. Sometimes patients with long-term conditions like asthma or diabetes can sometimes feel a bit anxious about moving over from a GP that knows them really well and starting again with a new clinician here, and that's really understandable, but I'd like to reassure everybody that when you do register with a new GP, your records do transfer across fairly quickly, so we do have access to a lot of information. The best way to register, particularly at the moment, to keep everybody safe, is to do it online. So the website's www.ulhs.co.uk, and there's a banner about halfway down. If you scroll down the screen, you'll be able to click on register with the practice, and it's a really simple form. Once you click submit at the end, it starts that process of transferring your records over. Most important thing to remember when you fill that form out is, because you're going to be moving to Lincoln, your home address is your university address. The best advice I can give is to make sure that you bring a supply of medication with you when you come to university. It's much better for you to have probably a month's supply when you arrive at university, because you'll need time to settle in. You'll have other things on your mind than dealing with your medication and having to see the doctor, hopefully, and you may want to have a chance to find out which pharmacy you'd like to use, that sort of thing, so it's best to be organised. There are two main ways to book an appointment. The first one's a traditional way of doing it over the telephone, which is great, and our administrative team are there to help you. The best way to do it these days is via our website. Again, at the top of the screen there'll be a banner which says e-consult. It will ask you to put in your personal details or means of contacting you, usually an email address and a mobile phone number. And then it takes you through a series of questions, so that's a bit like an online consultation with a doctor really, and it's actually been developed by doctors. And then we'll either get back to you via text message, phone call, or we'll invite you in for a face-to-face appointment depending what you need. Please only come into the building if you've been asked to come in, or if you have a booked appointment, because we're trying to keep everybody safe. And so the less people we have in the building, the better, which is why we're really keen on people accessing us via e-consult. And at least then you don't have to wait in a queue on the phone either. If you do come into the premises for a booked appointment, as you come into the building, on the left-hand side there's a touch screen, which is a booking in screen. If you hand sanitise before you use the screen, there will be a bottle of that available for you to use. And then if you have a seat, then whoever's going to be seeing you will come and collect you from the waiting room and take you to the room that you'll be seen in. We do ask that anybody coming in the building wears a face covering, so if that's a mask and you've got access to one, that's great, but it can be something simple like a scarf tied around your nose and mouth. We also ask for patients to come alone rather than coming with friends or groups of people, again to just reduce that footfall in the building. If I could give you any advice, make time for yourself, make time for your physical and mental well-being, because that stands you in the best stead to do well on your course as well. And hopefully we won't need to see you because you'll be well and healthy, but if you do need to see us, we're all here for you.